Hi, Turani. How are you doing? Good to see you and good to have you back.
Hi, how are you? Alhamdulillah, I'm
I'm good,
fine.
Alhamdulillah. I'm good too, Alhamdulillah. Good to have you back. Yeah. See, so today we are going
It's
to
a,
talk about part three, and earlier we used
exactly.
to meet in part two, right?
Yes, yes.
Okay, that's great. That's great. So Hina is also here. Hina, good to see you. Good to see you. Okay, that's great. We will start our session in like I mean 4 more minutes. Okay, let other participants join in as well. Dr. Hassan will join as well, and then we will start. Okay.
Hello, Tarani and Yamima.
Hi.
Hi, this is Dr. Uzma. How are you doing all?
Alhamdulillah, doing good. How are you?
I'm good, Alhamdulillah. In the meantime, we can just, you can introduce yourself.
Oh, sure. Um, I'm Turani Talukdar and I'm from Bangladesh. I did my MBBS from Bangladesh and then I did post-graduation FCPS, that one also from Bangladesh. And I practice in Bangladesh since 2017. After that, I moved to Malaysia and I worked there for 4 years. And after that, right now I am in KSA and I'm here for last 2 years. And I'm working in the medical university.
Okay, that's great, Tarani. Very good, very good. And we have Hanan and Yamima. Hanan, how are you?
Hanan, how are you?
Hanan has some maybe mic problem. Yes, Yamima. Can you open your mic and introduce yourself? Come on, feel free. We are just introducing each other. Nothing else. All right. So maybe Hanan, Yamima, some issues with their mic. Anyways, so Tarani, how you feel? How is it different from Bangladesh, practice in KSA, and now you are planning to move to UK after MRCOG, inshallah?
Actually, in KSA, I'm not practicing. My post is academic post. So
Okay.
the teaching post.
Mm-hmm.
So I'm not clinically practicing here.
Okay, so you thought you will finish your all education and then you will move to UK?
Hopefully, inshallah, not decided yet.
Okay, good luck to you.
Thank you
Okay,
so
when
much.
did you pass your part two?
I 2018.
Okay, all right.
No, part two
No,
or
no,
part
no.
one?
Part
Part
two. Part
two.
two.
Oh, part
January
two is this
2023.
year.
This year.
Yes.
2018. Okay, all
Yeah.
right. Okay, okay.
Part one was in 2018. When I
Okay, so
moved to Malaysia, at that time, actually, I decided to do MRCOG.
great, great. And did you get the seat? Is it confirmed yet or no?
Part three?
Huh?
No, I did not. I did not. Is it open?
No, 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 it's not.
No, no, no.
Oh,
I'm just, just asking you, getting information.
oh, okay. No, no, not yet.
Not yet. Okay,
Actually,
so
I'm not sure that this time, do they have the remote exam or not?
No,
no,
no.
no,
Face to
no
face.
remote exam now.
No,
It will be face to
actually,
face.
if it is not remote, maybe it will not be possible for me for November because my son has O-level exam in October and November.
Mhm.
So maybe I will sit for May session.
All right, it's fine. You keep practicing because it's different. The part three is different from part two. Now it's application of whatever you have learned in part two. And so you need to build on your speaking skills, on your communication. So you need to give it a lot of time to practice. It's a very doable exam, but the thing is you need to practice a lot. So try to find some study buddy who you can practice because since you are planning for May, you still have a lot of time. So, you can still do it gradually and surely. So try to find a study buddy who want to sit and, an honest one so that
Mm-hmm.
you can tell you what are your, shortcomings and what is your strength. So, you work on your shortcomings and your strength is already there. So it will
Okay.
be a good thing to start practicing from the beginning. Try to participate in the free activities in the group. And, it's not that because we are mentors, so we are telling you, but once we passed our exam, there were few mentors only. And really, it's very, very important to get guidance from the mentors who have passed the exam and who are doing this job for quite some time, because they know they can assess you where is you're lacking, where you need to be pushed a bit more. So that's very, very important.
Okay. Inshallah, I will start actually.
Yeah, it's very good. Okay, Zaib, we have few people now. Where is Dr. Hassan?
No idea. Let me ask him.
Mm-hmm. Yeah, so in the
He's
meantime,
joining.
anybody else want to introduce? Hanan, baby, Mayo, you are from where?
I'm from Malaysia.
Ah, welcome. How are you?
I'm fine, thank you, doctor.
Yeah, so when are you planning to give the exam? November or May?
November.
Okay, great. So did you get a chance to sit in this exam before or no? This will be your first time.
No, I just sat in May 2023.
Ah, all right. Okay, so I don't think you will be able to get a place. Sometimes at RCOG they open a lot of this one places for exams, so maybe you might get chance, or maybe you will get in May. Anyways, start practicing from now, because part 3 needs practice. It's all practice, practice, practice.
I think
That
this
coming
year they have so many face-to-face centers. So I believe almost 75 or 80% of the people will get chance this time. Because in India, they have had, the 3 centers last year, and UAE is a center now. So I have heard that they are planning for KSA as well. Then they have increased Malaysia as a center, then Singapore, Hong Kong, and then the UK. UK, I think the exam is going to be for 4 or 5 days. So I think they are going to accommodate, because I think now there is no more backlog from the COVID era and everything. So perhaps they are going to they increase the seats and all. So if they are increasing the centers, so I think the almost everybody will get the chance.
Yeah, if that is the case, then you all have to, gear up and start
Exactly.
practicing as much as possible and studying and stay focused, because this exam really needs a lot of focus and practice. It's very, very important.
Because this year, even the percentage was 62%, the people who have flunked this year as well, and it is just marginal. So it means that maybe they have missed, the 1 or 2 points, maybe in whole exam. So this way or that way, they have to start from scratch. So I would never suggest anybody to just, to give up on this exam and, the wait for good long 1 year. Rather than it's better to practice, even a single case a day, the 2 cases a day. So that is going to make a difference, because you have to be in flow this way or that way.
Yeah, of course. You never
Hmm.
give up. This is the main thing.
Exactly.
Never give up.
Exactly.
It's just an exam. You have to keep studying. Passing and failing is part of examination.
Hmm.
And you always learn from your failures. So don't think
Failures.
that you don't know anything. That's why you failed. It's not like that. Maybe there was something you just missed on that day. It was not a
Hmm.
good day for
Exactly.
you. That is all.
Exactly.
There is no, doubt that you don't have the knowledge. You passed part two. That means you are knowledgeable. You are competent enough to sit for part three. So it's just a matter of time. Keep practicing and then you will do it, inshallah,
Hmm.
very
Hmm.
soon.
Yes, number of attempts is always 4, of course. Okay. So you can skip one attempt in between if it is face to face. However, according to my knowledge, the online attempts are not included, whatever you have attempted before. So I think this is a good part on their, the account for the RCOG. Okay. Yeah. Attempts has always been 4, Hina. I think you are mistaken. Attempts has always been 4 attempts. Okay.
Yamima, nothing to be scared about. It's just an exam. They will not, kill you for it. So just do behave as you are behaving normally and naturally in your routine clinics. You are seeing a patient, talk to them in the same way, deal with them in the same way. Just follow their guidelines. Guideline and the application of the guideline is the key to success. This is the only thing. So nothing to be scared about. You think those people who have passed, they had something extra in them? No, they are just like you. So they just stayed focused, they studied, they practiced, and they passed. And so will you. Don't worry about it.
Okay, sorry. So, yes, like Dr. Uzma said just now that, maybe that was not your day. And I think this is a biggest, the thing that can be challenging. Because on the day of exam, maybe we are tired, maybe, the kind of feeling bad, maybe, we are not in our, like, I mean, kind of full command by the brain that we are going for the exam. So many things happens. I still remember back in 2018, I'm sure Dr. Usma remembers as well, when we were in London. So we have been calling each other. Okay. So I was in separate hotel, she was in separate hotel, but of course it was, the fairly distant from, each other. So we were just like, I mean, sitting there, and she was also upset. I was also upset because of course, when we are going for another exam, we are going to another country, another city. So sometimes, so many factors comes, which play on your exam day as well. So what I always tell my all students is this exam is not exam of your knowledge or anything. Perhaps this is the exam of your nerves. Okay, because by far, everybody is knowledgeable. By far, everybody has read, the all guidelines, blog articles. By far, I don't think that, the any of the student would go unprepared for this exam, because everybody knows that, how much we are investing in this exam. Okay, not in terms of financially, but of course in terms of time, in terms of, the our the emotional connection, our, the psychological stress as well, physical, mental, and I must say, the domestic as well, because when we are giving exam, it means our whole family is, involved in this exam as well, because they have to sacrifice, they have to compromise on our schedule and everything. Okay, so for me, this exam or any other postgraduate exam is exam of nerves rather than exam of, whatever you have studied. Because applied clinical knowledge is what you do on day-to-day basis. Applied clinical knowledge is what you have been practicing and you have been studying so far, okay, for your part 2, for your part 3, and everything, isn't it? So we are going to talk about domains as well. So, all you need to do is you need to be composed for that big day. Okay. So you need to be prepared for that big day. So we are going to talk about strategies as well in our, the upcoming slides. So, this is what, I think that this exam, moreover, is exam of nerves rather than, what somebody has studied, what, somebody has attended the courses, performed so many times. No. If you know the technique, if you know the tactic, how to go for this exam, trust me, this exam is ain't different from the exams we have been giving our whole life, because I'm sure, like Turani has mentioned now, that she has done FCPS from Bangladesh as well. Likewise, for us Pakistani candidates too, we also do post graduation. Then we jump into this. So of course we have been dealing with this, all these kind of exam. So why this exam has become so difficult? Just because the we maybe we are losing our concentration. Maybe we are comparing ourselves with the so many candidates around. Maybe we are not that focused. Maybe we are not the that kind of, I must say, the prepared for that big day. Okay, so yeah, this is what I think. Dr. Uzma, you remember when we were in London at that time?
Oh, yes, of course, I remember. It is really, as you said, it's an exam of nerves, and
Nerves.
you're traveling from your place, leaving your family. For me, honestly, my whole family was part of this MRCOG journey. I used to practice station with my son, with my daughter. If you scroll to some old groups, you will find my recordings there. I was just, you have to be very there's nothing like if you perform, you are shy, nothing to be shy about. It is just practice. Just practice. Put your recordings in the group. Let us listen to you so that we understand that, okay, this is where you can do well and this is where you need some guidance. So I used to do it a lot. I practiced with everyone. Everybody was, involved in my journey. And that's why once it's the graduation day ceremony, I took my family with me, and it was
Yes.
really, I felt so proud that I could do it. And after that, no
Exactly.
other exam felt that difficult for me once I finished MRCOG. Isn't it, Zaib?
Yes, exactly. So I think then we have given our two boards as well, MRCPI
Yeah.
Irish and then European, and we were together, isn't it? So yeah, we have faced a lot, like every other candidate as well. So all you need to do is you need to put your 100% efforts, hard work, and of course, the time, and I must say the emotional health, psychological health as well. Okay, because this exam or any other postgraduate exam is exam of nerves. Okay, if you are so much into this exam and you are controlling yourself as well in a good way, so trust me, this exam is not different than any other exam. Okay, so I think let's start our formal the session, because Dr. Hassan is just joining. So hello and welcome again the formally. So we are going to talk about, the what you need to know to ace this part 3 exam. Okay. So everybody knows us by far. Okay. I'm Dr. Zaib Qureshi, the mentor at my exam expert for the last 7 years. And we have with us, and he will join us soon, Dr. Hassan Mahmood, and Dr. Uzma is with you guys as well. Okay. So first, we would like to talk, we would like to talk about how to bounce back after failure, because this session is right after the part 3 May result. Okay. So I would like to take opinion from all of you who sat this May exam. And I would like to know that what are your strategies, that how you are going to bounce back for your, the next preparation. Anyone can volunteer. See, we don't know each other. Nobody is showing their faces. Okay. We are just voices connected to each other. So yeah, you can speak your heart aloud. You can tell us, so maybe perhaps, a kind of, the senior teacher. Okay, we can give you some kind of tips and tricks to ace this exam. Okay, so May, if I'm not wrong, so could you please tell me that what do you think that you could have done differently to pass this exam, and what are your thoughts about it?
Maybe to read the questions more calm and complete the
Okay,
question.
very good point. What else?
And
So
time
read question
arrangement.
carefully. Read question carefully. Okay, first point. And what else?
The time arrangement.
Time management. Perfect. Very honest judgment. Very honest judgment. Anybody who has had the opportunity to take this exam earlier, Maybe not this May, but maybe in previous years. Anyone? Okay, so let me tell you my experience because I have failed this exam as well. So when I failed this exam, the pass percentage was 62 and 60%. I scored 60%, and I could not meet the standard in 2 domains. Okay. So of course, once you get the result, you are so overwhelmed and you always think of why me, why me, why me. And at the same time, I was thinking the same. Why me? Because I have been studying with the candidates, almost whole of my batch passed at that time. And maybe, me and the 1 or 2 other candidates, who were unlucky at that time. Okay. So this way or that way, I was, of course, the very upset, very afraid, and the very demotivated as well. That okay, who is going to study with me? Who is going to give me, the hand to, the sit for this exam again? So of course, but there was no way out. That I cannot give up in this final exam. So what I did was I just sat with myself. I, the realized, like made it, the perfectly that you have to read question carefully. I had this, the kind of a bad habit to just come to the answer or to come to the conclusion rather than, the reading the question carefully. So, the rather than reading the question, what domain has been asked, and the maybe in one question the history taking was not the domain, but I started with history taking because we have been practicing with this. Okay, and yes, the time management as well. The next time when I went for my exam, I did not leave any loophole. Okay, I did all my modules. So I said, no, 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 I have to study. I did my perfect time management, but still I remember the last, the station I practiced with my study buddy. It was for full 11 minutes and 17 seconds. See, till even after that much of study, hard work, and time management, I was still not able to reach within the 10 minutes. Okay, and at that time I'm talking about the era of 2018. So we never had the so much of help. So many mentors were not working around. Okay, we never had the kind of free sessions around to facilitate any candidates here and there. So we had to work on ourselves. I'm sure Dr. Uzma will agree with me. So we were just like, I mean, practicing and studying on with ourselves, with each other, and the learning from each other as well, isn't it? So what I did was, for the next exam, so I didn't leave any loophole. I just started practicing the from the scratch, okay, with the time management and everything. And then yes, I did bounce back, and when I passed my exam, I failed with 2%. When I passed my exam, the pass percentage was same 62%, and I scored 86%. Okay, because of course, once you think that you have to do it, then you put your all efforts into it. All right. So I would suggest, May, don't be disheartened at all. Okay. Just give your 100%. Now you know your, the shortcomings. Okay. So you have to work hard on those shortcomings. Okay. Turn on your timer. Okay. Stopwatch or anything. Okay. Practice it with someone. Read question carefully. Look at what domains have been asked. Look at what your task is. Then I'm sure you're not going to miss anything. Okay, so now we are going to discuss some of the tips, how to bounce back after failure, because this is really hard. This is really a bad topic, a painful topic, I must say. Okay, so of course, everybody needs to know that how we are going to the fail or pass an exam. So first of all, you need to learn that we are in a competitive world. So understand that failing an exam is quite common. Never say that why me always. Okay, maybe we have missed anything. Okay, when many candidates can pass this exam, then why I cannot pass this exam? Okay, so RCOG is there to pass exam. Focus on you, focus on your shortcomings. All right, and feed the flame of forgiveness, please. Okay, so please don't always blame yourself. No, 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 if I would have studied for like 18 hours like though that candidate, I would have passed. If I would have taken that course, I would have passed. No, no course is guaranteed to give you any kind of success. Okay, so you have to feed the flame, please. Okay, so you have to feed the flame of forgiveness. You have to be easy on our in okay, on you. All right, so you need to understand this, that okay, that this is not only you who's failing this exam. Maybe like maybe the you have missed the quite a few points. in any station here and there. Okay, then you need to learn how you are going to regenerate, how you are going to regenerate yourself. All right, so you need to take some help like tutoring or online educational learning as well, because we all are now, after the COVID era, we are so familiar with distant learning, isn't it? So we at MedExam Expert, of course, we extend our help, we extend our support to our all candidates. Okay, we do try to give the maximum support to our all candidate, that how they can they prepare for an exam, isn't it? So next best thing what you can do is take some time off, but not too long, mind it. All right, so you don't have to take too long, the break. Okay, so like, I mean, if somebody is planning for next May exam, so starting from today, this is June, we are in middle of the June. Okay, so by the end of 1 year, do you really think that you are going to be in that state of mind that you are going to study your all part 2 guidelines, blog articles, you are going to practice again and again? Because human mind has a tendency that if you're not going to revise, if you're not going to repeat anything, so maybe many things are going to go into your subconscious, and maybe once you are going to revise them, so maybe the things are going to be easy. All right, so always remember that you have to focus on yourself, you have to be easy on yourself, you have to learn that how you are going to regenerate yourself. All right, and then what you need to do, you have to have a perspective. All right, and you have to recalibrate your expectations as well. And what are your expectations? Of course, everybody has expectation to pass this exam out of this much thorough struggle and that, isn't it? So how you are going to get that perspective? Of course, maybe if you think that you haven't given your 100%, so next time you are going to give your 100%, isn't it? And what is going to be your perspective? Your perspective is going to be, no, see, I have to give my 100% in every station, doesn't matter what the station is, doesn't matter if even if I don't know about that station as well, but I will give my 100%. And then of course I am going to reach up to that expectation which is desired by our COG to pass this exam. All right, am I making sense to all of you? Is it clear so far? Is it clear, everyone?
Yep.
Okay, great. All right, so then what you need to do, you have to manage your self-talk. And what do you mean by this? You mean by this is that you are going to think by the end of your day, every day, in fact, you are going to the kind of and do the analysis of yourself. You are going to think of, what have I done today, what could I have done today to make my day better? Okay, so if I have practiced 2 stations, so could I have done the 3 stations as well? So if I have done 2 stations, so were they the end to end? End to end means that I have tried to cover my guideline, I have tried to cover my blog article, I have tried to cover patient safety points, I have tried to cover applied clinical knowledge, what is desired. All right, so you need to the talk to yourself as well, because you and me or everyone, you can only be your best critic. All right, you are the best judge to yourself as well. Nobody can judge you, nobody can judge your preparation until unless you are connected to some the teacher who can the judge on in terms of your preparation. Okay, in terms of your the how much you are putting into it. All right, plus don't vilify your failure, don't vilify your failure at all. See, the setbacks are temporary. Take this setback as a temporary setback. It will definitely pass if given enough time, isn't it? So once you will start preparing for your exam again, so I'm sure you are going to forget about it. Okay, and one can only forget things one when they think that they are able to forgive anything. If you are going to be easy on yourself, if you are going to give yourself time to cope with this failure or anything or this setback, I must say, all right, so things are going to be very easy in the future. Plus the second most important the point is adjust your study habits. It is very much important. What do you understand by this study habits? Anyone? Any idea about this? How you are going to adjust your study habits? What are study habits, in fact? Anyone? Hmm? Okay,
I
study
can
habits
answer this
are.
question.
Oh, yeah, please. Oh,
Can you
hi.
answer this question? Hello, Dr. Zaib. How are you?
Hi, I'm good, Alhamdulillah. I was
Alhamdulillah.
just waiting. I was just waiting about you. For
No, I'm
you?
here. I'm here for the last 10 minutes. I'm just
Oh
listening
my
to you
God.
and just listening, yeah, to the your ideas, your thoughts. I would
Yes.
like to welcome everyone in this room. Thank you so much for being with us in this free webinar. Just to, you know, I know that very well what's meant by being unable to pass the exam because I passed through this experience twice before. So I know very well that it's a very disappointing thing, and a part of your confidence is being lost sometimes due to this event. But let's say that part 3 exam actually has no clear margins or parameters to pass. Let's say that in part 2, if I give you some tricks, if I tell tell you some points to study, where to study from, you will pass. But in part 3, the evaluation is more sophisticated and complex process, as we need to uh, making the candidates standardized in communication, in talking, in English, in expressions, in facial expressions, in body language, in knowledge, and the applied knowledge, and many things. So I believe it's difficult, and the Royal College policy makes it more difficult in the last maybe two exams. New
Exactly.
stations invented. The
Hmm.
I know very well the marking sheet. I swear, Dr. Zaid, that
Yes, I know.
if I did my best to pass the station, I will not pass the station if the examiners followed the um, the marking sheet literally. The marking sheet is unbelievably difficult.
Hmm.
Okay, unbelievably difficult, and they are stressing on um, you know very tiny points that will never come to your mind in the station. So why people paused? Why other people could not do that? let's say that let's say that the most important thing for this exam not to be uh, pioneer in knowledge.
Hmm.
Knowledge is the last domain to be evaluated, and this is the fifth common fall to all candidates in this exam. They are trying to talk a lot, giving a lot of information, show knowledge and competency, while actually what I believe in that in this exam the knowledge is just headlines of any topic, just headlines. How can I treat SUI? Lifestyle modification, physiotherapist, pelvic floor muscle exercise, surgery maybe if the patient is not uh, um, accepting the surgery, we can go for some medications. This is the answer. No details, no depth in knowledge. Okay, because if you try to go more and more in depth with knowledge, you will lose three other domains: patient safety, communication with the patient, communication with the colleague. You will lose them easily. So the other problem is the judgment regarding, uh, for example, a domain of information gathering. Most of candidates will never fail before in information gathering. Am I right? Say
Yes,
we,
yes,
we are
exactly.
we are never experienced failure in information gathering because you are just asking some questions, taking simple history, and that's it. So you will gain the mark. But nowadays, failure in information gathering is more common than usual. Why? Because the judgment is now different. Now, in the marking sheet, if you try to take full history, you will be borderline, despite you asked about everything. But it means that simply you are not being able to identify the relevant points. So I will give you borderline. Okay,
So
me and
that's why
other
they say
examples.
focused history or targeted history,
That's
isn't
why
it?
relevant history, focused
Exactly,
history,
relevant,
targeted history,
targeted
and
history.
people, and still up till the last exam, imagine that people are
Two
still
pages long
asking,
history.
what do you do for living?
Exactly.
Tell me about the support at home. Why you are asking about support while the
Hmm.
woman is just having some flushes of menopausal?
And start smoking alcohol.
Smoking, alcohol, recreational drugs for
NHS
a
stop
woman
smoking
70,
cessation
for a
program.
woman, yeah, a woman 70 years with ovarian cancer. You are asking about recreational drugs. Why you are asking about this? Okay. If
Because we
she's
have been
an
taught.
addict woman, yeah, if she's an addict woman, she 100% will be passed away for many years ago. So, so don't ask stupid questions, just to fulfill spaces. It's not a game of fulfillment. Okay.
Exactly.
I saw people, they are asked, a woman in primary infertility, she's looking for a baby. So, and then they ask her, what kind of contraception you are taking? She's not taking contraception. She's looking
She's
for
seeking for
pregnancy.
fertility.
Okay. In the last
Exactly.
2 years, she's trying. Okay. So why you are asking about fertility? I mean contraception. So questions should be more precise. And now information gathering, I think it's a crime to fail in information gathering because it's very easy point, very easy domain. Now the third point is I think most of candidates they don't understand what are the points that will be tested in patient safety. I think in this room we have 20 friends. Okay, if I ask people what are the patient safety points you need to remember in each station, more than 80% of people they don't know what are the points they need to fulfill in patient safety. The knowledge I know, information gathering are questions, patient communication, it depends on the scenario. But what about the patient safety? The most important thing to pass in this exam. Now, the patient safety, you should understand that it's related to anything of clinical governance. Like if I need to write an incident report, risk management team involvement, social services, safeguarding teams, audits, uh, um, uh, SBAR, all of these stuff are under the domain of patient safety. What else? Drug interactions are considered under patient
Hmm.
safety. If I'm gonna giving the patient a treatment with side effects, I have to talk about the side effects. I have to be sure that it's not a contraindicated medication. Okay, labetalol. Patient is taking labetalol, but she's asthmatic. I, I will fail 100% if I offer labetalol to asthmatic woman, ulipristal acetate with asthmatic woman, and so on. So this is a patient safety. Number three, what about the bloods, blood transfusion, objections for blood transfusion, NTD, RH, pregnancy test, all of these stuff, if missed, believe me, you will never pass this patient even if you did very well job. Let's say, for
Exactly.
example, we have a very famous scenario with a patient, she's premature ovarian insufficiency. It came in the exam, okay? Premature ovarian insufficiency, she's amenorrheic for the last 9 months and has some symptoms like flushing, headache, bloating, and she's looking for a baby, okay? So you have to break the bad news. Now, you 20% of candidates, just 20% of them, they remember to ask first about pregnancy tests. Did you have any pregnancy tests? Other people directly going to break the bad news because the FSH is around 90. So it's a finished game. They didn't think even about pregnancy test. While the scenario, the patient is amenorrheic. So if the candidate missed pregnancy test, he should be marked as failed.
Yes,
I have
absolutely.
nothing to do. I have nothing to do. I will never be able to help. Now, to summarize that, we need to understand what the exam needs from you all. It's not an oral exam. It's not an exam to test your knowledge and to test your pioneer experience in practice. It's just an exam to be sure that you are a decent doctor, you are a lovely doctor, respectable one, communicating well, and never doing major mistakes. This is the game.
Exactly.
Okay. Otherwise, you know, in the applied clinical knowledge in the exam never exceeds 20% of the total mark. So you can say whatever you want. I will give you 20% from 20%, but you will lose 80%. So you have to be balanced, okay? And it's very important again to know what the exam needs from you. Uh, we need to do this day together and in our job later on with people. I think it will be very beneficial to give another session with what are the points in each domain. I need all of people to revise them and to remember them in exam regardless the station time. Okay, because these points will be tested in all stations. So if you cover them, most probably, according to each scenario, you will be in the safe side. Am I right?
Yes, 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 absolutely.
And
Absolutely.
finally, I know I'm too much talkative person. I'm sorry, Zaib.
No, no,
but
no, it's okay.
I let's say that it's not about failure. Again, people who could not achieve success, they didn't fail. The point again is it's a marathon, and you are not still in the ideal attitude to compete with other people because you lost some important keys, but it doesn't mean that you failed. There is no failure in this exam. Okay. And another point, once you reach part three, be sure that you will pass. It's almost never happened before that you reach part three and then you fail the four trials and you start from beginning again. I
Exactly.
never saw any kind of these scenarios before. Never. So be sure that before finishing your trials, you will be MRCOGN. Just trust yourself, and instead of being anxious and disappointed and sad and all of this stuff, try to revise where are my mistakes and then try to improve these mistakes. Automatically, you will pass. You know, I failed twice in part three. Okay. In each time, I was so much disappointed. I said, why? I am perfect. I did a lot of work. My friends studied with me. They passed, I failed. They studied from my papers. And then I trained them. They trained me. They passed, I failed. Unbelievable. And then the third time when I passed, I my mark exceeded the pass mark by around 18% or 19%. In this time, I noticed the difference in attitude between Hassan who will pass and Hassan who were struggling to pass. This is a big difference between both versions of me. The first one is struggling to pass. The second one is, you know, dealing easily with the stations because finally I understood what is the aim of this exam. Once you catch the point, and finally, I noticed this. Unfortunately, most of candidates they are trying to attend more than one course. You know that.
Yes.
So sometimes my technique is different than X examiner or mentor. Both of us are different from Y mentor. So
Exactly.
I noticed that most of candidates who attended more than one course, particularly courses, they are by the time losing their identity. So they are confused. They are doing mistakes. I'm asking them why you said that or did that. I had the same information from another one. So this is too much confusing.
Hmm.
So my advice, whatever the mentor is, whoever the mentor is, whatever the course is, choose one good preparatory course and be stuck to it. Don't try to jump between different kind of courses because the material is almost the same. The
Hmm.
differences are regarding the techniques and how much you are understanding the core of the exam. I believe that me, Dr. Zaib, are understanding the core very well because we are examiners. I, I examined more than 800 persons from 2020 till now. I saw all stations, I saw all keys. I know the tricks.
Keys are
Okay.
way
So
different.
are very different,
Very different.
far away from all what people said. Okay, we
That's
are
it.
looking for, points, and actually the exam is looking for different points completely. So don't listen to more people because you will get confused at the end. This is my last advice. Trust yourself, people. Do the best. Dr. Uzma is here. Dr. Zaib is here. I will try to do my best with all of you. I think we will be able, all of us, to pass to success, land together, but by more concentration, more dedication, and I wish all the best to all of you.
Yes, brilliant. Thank you, Sir Hassan. Thank
Thank
you.
you, Sain. Thank you, my dear. Thank you.
Any questions so far, guys, regarding how you are going to bounce back after one failure? Any question?
I didn't see Dr. Uzma. Is she here?
Yes, yes, she's here.
Hello, Assalamu alaikum, Dr. Hassan. Yes, I'm very much here. I was listening to your valuable talk.
Thank you, Dr. Uzma. I just would like to say hi for you. I appreciate your presence. Thank you so much.
Thank you so much, Doctor.
Any question, guys? All right. Okay, Dr. Uzma, would you like to have, the something on this?
Yeah, actually, we were already talking to our people who are here with us. Yes, Shamima, what is your question? Keys are different. What it means? It means that I think Dr. Hassan can answer this question very well, right, Doctor?
Which question? Ask me.
She said keys are different. So what do you mean? Exam
Keys
key.
are different. Yes. Let's see. Let's explain. I will give you one example just to illustrate what I would like to say. For example, in information gathering, okay, what is in your mind and what is the truth? In information gathering in your mind, I have to check everything because all cases, they could be domestic violence. She's maybe not supported at home. She's maybe blah, blah, blah. So I have to ask about everything in systematic way. Let's say, my dear friend, that in examiner's briefing, we are smiling too much because the British examiner, they said, we saw, hello, can you hear me?
Yes, we can
Yes,
hear you,
yes,
Can
Doctor.
you hear me?
yes, yes.
Yeah, they said we have 14 copy and paste persons. We saw 14 copy and paste persons. What does that mean? It means that 14 people get inside the same station. They asked the same questions in the same sequence, and all of them get borderline.
Exactly.
Imagine that. And then people and like that, because you get borderline many times, and then you will not be able to achieve success. Now, what is the truth? The truth is, in marking sheets, in information gathering, they just write for me and for examiner asterisk points on targeted history. So you didn't give me target history, I will give you borderline. and then maybe 1 or 2 points only critical in the history. For example, if the patient, we are talking about a heavy menstrual bleeding scenario, if the candidate missed to ask about fertility wishes or contraception, hormonal treatment they are taking, they should be marked as borderline or fail. These 2 points only, the mark goes for these 2 points, not for other points. You understand? So you wasted around 5 minutes taking history, which is useless, useless
And
history. Now
exactly. I
imagine
would,
that
yes,
the 5 minutes will affect your further performance dramatically because you have to talk to fulfill everything in other 5 minutes. So simply you have no time, no attitude to show communication. So you will gain borderline or fail in information, pass in applied knowledge, fail in safety, borderline in communication. Overall, you fail. This is how the station is evaluated. Okay, this is just an example for what is meant by the key is completely different than what is in your mind. You got my point? Is this a question in the chat room? Yeah.
mm, yes. And plus, I would like to add one more thing here is that not all domains are going to be tested in one station. Okay. So maybe, the 1 or 2 domains are going to be tested, which will carry high marks, which we do see as an examiner in our keys as well. That, okay, that in this, if a candidate hasn't, the uttered this particular sentence, okay, in every exam sheet, we will have, the kind of certain marks, okay, certain, the sentences, certain, you can say the weightage of the answers. So if somebody is not, the telling anything, the kind of, the 2 things, so maybe borderline. If candidate is not, the telling anything from that, the particular exam sheets, okay, so yes, doesn't matter if you have communicated so well, doesn't matter if you were smiling, doesn't matter if your examiner was smiling, doesn't matter if role player was smiling as well. So if you haven't said anything out of that, so of course you will fail the station. So by this, the candidates get, yeah.
One of my friends, she was a candidate with me in the previous exam.
Uh-huh.
Natalie, the
Yes,
highest
yes, I
rank, the
do.
highest
Yes,
score.
yes, Natalie. Yes.
Natalie, I examined Natalie in the
Hmm.
exam.
Hmm.
I remember what I give her exactly. I give her
Wow.
fail, 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 pass. Okay,
Hmm.
because my station was extremely impossible. Okay, however, she got the highest rank. She got, I think, 79%,
Yes,
while the
yes.
pass mark is 62.
Hmm.
Okay, what's that means? It means
She
most
must have scored
probably,
high.
yeah, she scored high in other stations. My station was extremely difficult. So all people most probably failed in the same station.
Hmm.
Okay.
Hmm.
So it
Exactly.
will never affect the total mark.
Exactly.
All
One station
people
will never affect. Exactly.
never, even because it's very difficult for all people. So all people will gain 3 fail, 1 pass, 3 fail, 1 borderline. So it will never change the total mark rather
Hmm.
than that.
Hmm.
But the problem always is in easy, straightforward stations.
Exactly.
This
Exactly.
is these stations make difference between people and each other because
Hmm.
in easy station, competent candidate will finish it by 4 pass. Now, if you did any mistake or you missed anything, you will fail in the exam. So
Hmm.
most probably, my friends, don't push too much on difficult, strange stations. Try to fulfill the easy stations. Once you cover them, you will pass easily. You got my
Hmm.
point.
Hmm. Exactly. So Mona has a question that needing example for safety and its relation to knowledge. Okay. So we have a very, the beautiful example in nausea, vomiting in pregnancy. Okay. So we don't give dextrosaline for the rehydration, isn't it? Because it is going to increase the encephalopathy. Okay. Then we do have OHSS. We don't give NSAIDs because it will cause, the volume restriction, and of course, patient will be prone to have kidney failure. Okay, so these are two most important examples in terms of safety and relation to the knowledge. Third is, like Dr. Hassan just said, amenorrhea. In any kind of amenorrhea, primary, secondary, you need to exclude pregnancy. You need to do urine pregnancy test. If nobody has done pregnancy test so far for amenorrheic patient, trust me, you will fail the station. Okay, doesn't matter if you have
Exactly.
excluded all, the long causes starting from
Mona,
hypothalamus and exactly.
Mona, the examples are abundant examples.
Yeah,
Consent. If you miss consent, you will fail. You are
exactly.
going to discuss with a patient in the second stage of labor that she needs urgent
Hmm.
instrumental delivery. You did everything. You didn't take a consent or mention even the consent. You failed the station. Thank you. Okay. Uh, um, if you offer the patient prophylactic antibiotics and you didn't say after exclusion of allergy, you will
Allergy,
fail.
you will fail.
You will fail.
Exactly.
Yeah, and another point, Zaid, I would like to take your opinion with Uzma as well. Why people, always in all marking sheets, the mark always goes to immediate and proper response to patients' concerns. Am I right?
Yes.
Yes.
Okay. Now see the candidates' actions. Tell me, please, do you have any medical disorders? Yes, I'm diabetic, type 1. Okay. Any surgeries before? Stop. Why you don't react to the patient's concern? She's diabetic,
Diabetes. Yes.
okay? Okay. I saw one candidate. She tell me about the any previous pregnancies. Yes, I had termination of pregnancy once before, and this is my second pregnancy. Okay. Are you
Okay.
allergic to anything? Do you smoke? What are you doing? The patient had termination because the previous pregnancy she had a baby Down syndrome.
Hmm.
Okay, and you missed this. And once even you may ask, and then the reaction is very poor. I had a baby with Down syndrome and I had to terminate my pregnancy. Okay, any surgeries? Where is
Okay
the
is not
sympathy?
okay.
Yeah, where is the sympathy? Where is the
Yeah,
reaction? I'm really sorry for that. Would you like me to contact you with any counselor? It will be helpful for you. Are you coping well?
exactly.
Imagine that. This is the exam. I will never give you extra mark if you asked about surgery because it doesn't matter for me. But I will give you a good mark in communication because you are caring about the patient. So my always advice is respond immediately.
Acknowledgement is
Everything,
necessary.
any
Exactly.
any any positive finding in information gathering, respond immediately right now. Don't wait to the end of the station. You may
Hmm.
forget.
Hmm.
You may not being able to cover everything in the certain time, and maybe the patient will not give you according to her agenda a space to move more and more. Okay, so utilize the moment to the maximum. Try to respond immediately.
Hmm.
It's not a game of doing the same as all people. It's a game to cover everything smartly.
Exactly. Exactly. Very good point, Dr. Hassan. So, in nutshell, you have to acknowledge, okay, whatever patient is telling you, whatever patient is going to give you, any kind of knowledge. At the same time, at the very same time, don't wait for your, the complete set template to finish. Okay, Dr. Uzma, anything?
Yeah, no, I was just listening, and very, very important points Dr. Hassan highlighted, because since we are doing courses and we see candidates, it's really so difficult to, bring them back to the life situation. They want to just tick their history taking. Somebody has a
Hmm.
IUFD, or especially breaking bad news. My God, they want to stick to their agenda. Okay, I will come to your this one
Exactly.
answer.
Wait,
I will come to your question
I will
again.
come to this
If
point.
yeah,
Yeah,
she is stressed. She want to know the result of her ultrasound or whatever. You don't want to tell her. You want to fulfill your this history agenda, your whatever you have in your mind. Don't
exactly.
follow your agenda. Please follow patient's
Patient's
agenda.
agenda.
Read the question properly. This is very, very important. Which domain has marks? What they want to know in this station. You want to just, have something in your mind and you want to do tick, 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 tick. Okay, I'm done. It's not, it doesn't work like that. You have to be very natural. If somebody's saying that my baby passed away or I had a termination for anything, you have to stop, as Dr. Hassan said, answer there and then. If she says, I am diabetic, oh, since when you are diabetic? Is it under control? What medications are you on? Don't say, okay, then later smoking. Do you drink alcohol? Okay, smoking, just address smoking. Why you're asking, not just to fulfill your tick mark, okay? So please, this is very, very important. So briefly, before I start this thing, how the exam will be, I just want to tell you briefly about myself. I was a student of Dr. Hassan, okay? And
I'm
once
also
I
a
was
student of Dr. Hassan. So
yeah,
he is
Zaib.
teacher of us.
Yes, he's
And a
our
great
teacher,
person
our
as
mentor.
well.
And Alhamdulillah, this was the only course. Zaib told me to join Dr. Hassan, med exam expert, for the course I joined.
Zaib, it was my pleasure and honor to study MRCG Part 3 with you both. It's
No,
my
really,
pleasure and
Doctor.
honor
It is
always.
our really, I feel honored that I'm working here as a mentor with you. It's a big thing for me because once I was giving the exam, I had all the big names in the course who all are running their private mentorship now, okay? And the exam, I exactly remember that before the exam, there were mocks in the part 2 med exam. And then Dr. Hassan used, I said that I don't, because somebody put in my mind that it's impossible to pass in first attempt part 2. That I'm talking about 2017, and it was my first attempt. So I remember my words that I don't believe in miracles. So I don't think I'm going to make it, but I feel the brilliant stars who are here and I appreciate them and this and that. And Dr. Hassan told me, but I do believe in miracles and you will make it. And I passed my first go. And our result, mashallah, maybe 3 times they reevaluated the result and gave us, because there was some problem. But alhamdulillah, each time, each mail, I was passed.
That was a terrible time for us. Yeah, it was a terrible time for us.
So just trust yourself and, do it.
Give yourself time.
Yeah, give yourself time, trust yourself, you can do it. It is a very doable exam. And anybody and everybody can do it, provided they are focused, they are working hard, and hard work doesn't go waste. Never, ever.
Never, ever. Okay, Dr. Uzma, we have one question by Dr. Leknath, and he or she is asking that, can I take part face-to-face exam from another country? Look, my dear, the RCOG, so far we know that the exam is going to be from the address given on your, the RCOG address book. Okay. So if the, the address is for the UK, so of course you have to opt UK. And there is no center which is guaranteed for any success. This is just you, your preparation, and yourself. Okay. So never think of that, okay, that center is easy, so I will go for that station. Okay, that center. Okay. So none of the center, all of us, me, Dr. Hassan, Dr. Uzma, we all passed from London, okay, from UK. So there is nothing, which is going to change your, in terms of center. Okay. So please don't think like this, that, that any center is going to give you any easy, the door to escape the exam. Of course, no. Okay. Because all examiners are trained by RCOG. Okay, this way or that way, the exam is going to be, there.
The exam is going to be the same. The mentors will follow the same key. It's going to be the same. So it doesn't matter you are sitting in India or Singapore or wherever, but you have a chance of increased chance of passing the exam. It doesn't work this way. So don't fool yourself. Just focus on preparing yourself for the exam, any country. Okay.
Exactly.
This
so we
is
passed
the
from, the UK. So do you really think that, we were not able to pass this exam from UK center, that we were less, the prepared, or we were less, the brilliant or bright students? Of course, no. And we have failed from the same centers as well. So it doesn't matter. So if we can fail and we can pass through the same, the center, it means that you can also do that. Okay. So never think about centers. And there is no virtual exam, Zahra. Okay, now there is no virtual exam from this November 2023 onwards. All right. And another question is from Mahnaz, that she's asking that is there going to cut any, they are going to cut any marks if we don't give any patient information leaflet? So the answer is big no. Okay. So yes, it may give you, the good, the kind of, the weightage on your, the communication, okay, with the patient, but not the marks, okay, because that is not that much important. It's always a good idea to offer patient information leaflet, but it is not mandatory. If you have covered all your points, then it means that you can do it. Okay. If you have not covered your all points and you are just worried about closing the loop and giving the patient information leaflet, so please don't do that. Okay. So over to Dr. Uzma. Manaz, is it clear? Zahra and Leknath, is it clear to all of you? Uh-huh. Okay, brilliant.
All right. Thank you very much. Yeah, so as you know, you have already finished your part 1 pass, part 2 pass, and a big congratulations on passing part 2. It is a very, very tough exam, and you must have all the knowledge in the world to pass it. So a big congratulations to all of you who are sitting here and are preparing for part 3. So it's, it's a big achievement for all of you, and your success is just around the corner. So don't worry about it. Okay, so as you know, that from November, the exam is going to be face-to-face. So face-to-face, it's very important that your words and your body language are the same. If you are trying to show empathy, your body language should also feel that, the person who's sitting in front of you, they should feel that, yeah, you are feeling for them. If somebody is saying that I have pain, or if you want to tell her that there's a breaking bad news, then your body language should go with it. So don't just, be like a wall and just break the news. Go with the flow, like a normal person, like you are doing everything naturally and normally in your daily life, in your clinics. So just behave that way. Okay. So the exam, there will be 14 stations. And there will be sometimes the simulated patient task will be more, sometimes the structures discussion will be more. So we cannot guarantee how many will be a simulated patient task, how many will be structured discussions, but slowly and gradually, I think they are increasing the number of structured discussions. So maybe 7-7, sometimes 9-5, like that. We don't know. It is not, exactly divided, but yeah. So in simulated patient task, there will be a patient plus examiner plus a lay examiner. Lay examiner will be from the community, and they will assess that are you fit to work in UK with them. So they have such stations where you see another extra person sitting. There's more weightage, there are more marks in that station. In that station, your communication is very, very important with the patient. Okay, so don't focus on the examiner, please focus on the person, the role player. Just address all what she wants to know, okay? And address her questions at the same time. Don't keep it for later that, okay, I will come back to your question. Please answer this, answer that. No, it doesn't work like that, okay? Then in the structured discussion, that is only with the examiner. And structured discussion is mostly your guideline or your updated talk or your scientific paper, whatever is the recent thing, your preparation should be based on that, okay? So here it will be just your knowledge mostly, which will be tested in the structured discussion. Then, as I said, there's a lay examiner, and then there's just a simulated patient task where only 3 people will be there, your examiner, your role player, and you. So what you do, you have 2 minutes of reading time. Before, for the online exam, there was 2.5 minutes, but in the real exam, face-to-face, you have 2 minutes of reading time, and then 10 minutes of performance. You finish your 2 minutes of reading outside the cubicle. The station is outside and it is inside as well. It is there on the table. So if you cannot, remember everything outside, the same station is lying inside in front of you on the table. So you can just always have a look at that. Those 10 minutes are yours, okay? So it is up to you when you want to start station. If you feel that still you need another 30-40 seconds or 1 minute to understand how you're going to about the station, take your time and then you can start. Okay. Then after 10 minutes, you hear the bell rings and you have to move to the next station. If you haven't performed well by any chance in that station, just forget about it in the next station. This is very, very important. So taking these circuit courses before exam, they will really help you prepare to be prepared for the real exam. Because if you carry the previous station with you in the next station, you cannot perform well in the next station as well. Forget about what happened in the previous station. This is a new station. The examiner doesn't know, the role player doesn't know how you perform in the previous station, okay? So this is a fresh new chance for you to give your best. So try your best, give your best, and then next to the next station. It's very important. They always used to tell us, remember, Zaib, don't eat, don't drink, don't take caffeine,
Exactly.
no washroom is
Exactly.
allowed. So
Exactly.
please make sure that you finish with the washroom before going for this exam, because it is a long circuit, okay? And
Okay, here I want to add, the one more important thing, the attire. Attire should be comfortable. Okay, shoes should be comfortable because in RCOG you will see very, the small cubicles. Even you can overhear the candidate next to you performing the station. Okay, so sometimes what happens is that it can distract you. It can, give you, some kind of nauseous feelings at that time as well. So you need to concentrate. Plus, for the girls, it is very much important. Don't wear any heels because in RCOG everything is wooden. Okay, so the wooden floor, wooden ceiling, and sometimes the heels make a lot of noise, talk 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 talk. So when somebody is moving from one cubicle to the other cubicle after the bell rings, it gives a lot of the kind of distraction, a lot of distortion, a lot of headache as well. I remember I had a terrible headache after my exam, the first trial. Okay, so make sure that your attire is very, the comfortable. You yourself are feeling so comfortable. Your shoes are comfortable as well. Plus, for the girls, no heels. Okay.
yeah,
Yes.
so make yourself comfortable first, and then only if you are comfortable, you can make the role player and the
Role
patient
player.
and the examiner comfortable. That's very, very important. So, okay, they look very tense, and exactly how this is how we looked also once we
Exactly.
are standing outside the station. But it's okay. You need to relax. Okay, take a good night's sleep before the exam. Forget about everything. I've seen people, carrying papers in the that waiting room outside the exam. They're still reading. My dear, this is not the time to read. Don't make yourself stress. Just forget about everything. Now you are in the exam. Be yourself. You have the knowledge. You can do it. Okay. So just read very carefully. That's very important. Just understand where are the marks, what domains are they testing. If there is no information gathering, please don't take your history template. Don't make that tick, 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 tick. It's not, there's no mark. You're just wasting your time. The marks are somewhere else. So please focus on what is being asked, okay? And then you go inside and you start performing. Okay, understood? Any questions?
And like for the 10 minutes time, of course, these are the question papers. Sometimes you will get, the many sheets because you will get, the ultrasound, you will get biochemistry reports as well. So many, the papers. So don't get, the upset by seeing all these things. Always remember, you have to do the task. Okay. So what you will do is that you will read your question. Okay. What domains are being tested, what your task is, what exactly the patient is coming with. Okay, the presenting complaint is very much important to start your station. All right, so if you don't know what patient is coming with, so you can start your station bluntly from the patient. How may I help you today? Okay, so she will give you, the whole information rather than, the looking here and there, that I didn't get the idea, by which complaint patient is here. Maybe, the question is too long. Maybe you didn't, the read it properly. Maybe you were thinking about the previous station as well, and which is very normal. Okay, being a human being, of course. But of course, don't carry the baggage. Okay, don't carry the baggage from the previous station at all right. So even if you have missed scanning, the one or two papers outside, okay, the pasted which are being pasted, so don't be upset. enter into the cubicle for 10 minutes station, okay, because they are not going to wait for you. You have to finish your station on time. All right, so you will introduce yourself, you will sit, and then you will take permission from the patient and the examiner, or the examiner as well, that would you mind if I take just 30 seconds to scan the question, because the same questions are going to be in front of you on your table. Okay, so don't be upset, nobody is going to snatch anything away from you. Okay, everything will be for you, because this is for you and this is for your exam. All right, so utilize whatever you want to do. All right, utilize 10 minutes time. 10 minutes is yours. Doesn't matter you want to spend it wisely, or you just want to stay quiet and you don't want to talk to the patient or the exam. So nobody is going to give the damn about that. All right, so remember, you have to utilize your 10 minutes time wisely as well. Okay.
10 minutes and these 2 minutes, because I
Exactly.
remember there is a very famous station which keeps coming in the exam, where the patient is a case of this one, back problem. And
Spinal
she
cord
wanted
injury.
to know, sorry?
Spinal cord injury.
Yeah. And then there's a scan like there. She doesn't know that she's pregnant. Now she's 20 weeks pregnant, and she just came to know, and she wants to know that is her baby is also having spina bifida or no. And it's written on that scan that baby doesn't have a spina bifida. So if you don't read that exam, because I'm telling you my own experience, okay, what I did, I was very panicked. I didn't read properly. And then what I understood from the this one ultrasound, that the baby has a spina bifida, although it was a normal scan for the baby. Okay. So the station, I failed, of course, that station, because the baby didn't have spina bifida. So you have to really stay calm, read properly what is given to you, and then you go inside the station, because then once you will tell the baby is fine as per this scan, then the next question will be, are you sure my baby is going to be fine? Then the station builds from there, that what are the other ways where you can confirm the baby has something or no, some abnormality or no. And this is how it goes. So please read properly what the information which is provided in the station, read it, then compose yourself and go in the station, and you can do it. Okay.
Exactly.
Yeah, Zaib, over to you, I think.
Oh, okay, fine. So in terms of curriculum, okay, so the curriculum is same as our part 2. So we will have the modules. Okay, so we will have teaching module, core surgical skills, post-operative care. So some of the time the modules will overlap as well, so don't worry about it. Gynecological problems, and sometimes it can overlap with sexual and reproductive health module. All right, so it can overlap. So fertility, very important module, very the sensitive and very interesting one, and an important one as well. Early pregnancy care, antenatal care, postpartum care, maternal medicine, very important, and management of labor and delivery, and clinical governance topics as well. All right. So what you have to do is that you have to prepare yourself in the lines of course guidelines, in the lines of TOG articles, in the lines of of course all the guidelines been given by the Royal College. All right, so what you have to do is that you have to cover what is teaching. Teaching is not like that that we are the talking at the moment. All right, teaching is going to be that you yourself as an exam candidate are the ST3, ST4, or say ST5, and you have to teach anything to your junior colleague. Okay, this is what we do in our day-to-day basis, isn't it? We have done our training from our respective countries, and I'm sure the similar kind of curriculum is being followed. Maybe not the pattern, but the curriculum is almost same. Okay, maybe it is not the kind of labeled one, but still we do follow the same. All right, so teaching is going to be that, core surgical skills, post-operative care, gynecological problems, and everything. So every module will have the topics. All right, so of course if you want to talk about the teaching, so what type of teaching could come in exam? Anyone, any idea? What RCOG can expect you to teach your junior colleagues? What is important? CTG. Okay, CTG is important, partograph is important, then the vaginal delivery is important, ECV is important, breech vaginal delivery, it can come. All right, it can come as pessary as a teaching. All right, then how to take a consent. Okay, then there's so many things like this. So what you need to do is at least you have to cover that, at least those recurring topics which are coming, the all the time in exam. All right. In terms of core surgical skills and post-operative care, of course, there are going to be number of things. All right. Like, the steps of, cesarean section, the steps of, the total abdominal hysterectomy, very important one, vaginal hysterectomy steps. Okay. Then maybe, they can ask you that, okay, from the basic laparoscopy, how you are going to insufflate the abdomen. All right. So what you need to do is you have to bring your laparoscopy or hysteroscopy guideline into the action, and then you have to, the talk in terms of that, how much is the pressure from the primary port initially, how much it is going to be, what are the safety checks when you are going to insert your varicetal, and what you are going to do at that time, how much is going to be the pressure. So this is what, like Mona has asked, the applied clinical knowledge along with patient safety, both are there. All right. Isn't it? So the same patient, if they are asking you for this post-operative care, of course, so you have to know that what kind of post-operative, the care do you give to your patients. Okay. So the many times what candidates do the mistake is that patient is having pain, and they are much more concerned with their history. Like Dr. Hassan said that please don't bother about your history at all. It is not that important at all times. If you are not going to validate the patient's concern, if you are not going to acknowledge the patient's, the pain or, the suffering, trust me, you may fail, the communication with patient, you may fail patient safety as well. Because if I am suffering at the moment, if I am having any problem, and if I'm telling you, so if you're not acknowledging that, it means that you don't validate my pain, you don't validate my problem. That means nothing to you. You have your exam, so that is what is important to you. Okay. Nonetheless, it is okay. But for the examiner who is observing you, you are failing your one or two domains. So who knows that those two domains are important domains to pass this particular station. All right. So make sure that you are, the rehearsing, you are practicing that way, that you are at least trying to cover important aspect of every, the module. All right. So of course, in terms of gynecological problem, amenorrhea will be there. Okay, MRCA, Turner syndrome, sexual reproductive health, the infections, bacterial vaginosis, Trichomonas vaginalis. Then there is going to be, the couple of other, the emergency contraception, all important topics what we do see in our day-to-day practice. So exam is not a, the out of the box. Exam is not from, the out of syllabus. It is what we do see in our day-to-day, the basis. Maybe we are not working in NHS at the moment, but still, we are doctors, we are practicing doctors. We do see almost all these patients on every day. Okay, so if you just imagine and evaluate the 14 stations theme, you will definitely correlate it with your the clinical practice as well. For the 10 minutes I have the patient with IUFT, I have to break the bad news. The next patient is vaginal discharge, the next patient is the secondary cystocele, and the other patient is with any cancer or maybe any other thing. See, we are we are adapting the role of different doctor in different patients. Likewise in this exam as well. Okay, so make sure that you are being embedded in the role of different doctor and changing the role from one station to the other station. All right. Then comes, the how to succeed in part 3. So I would like to have Dr. Hassan to comment on this, because Dr. Hassan, are you there? Okay, so I think he's offline, no problem. Your course has fixed days and time, how we can manage with the duties? Well, see, sometimes we do accommodate, okay? Sometimes we do see, because we all are doing jobs and, the everything as well. So of course, we can discuss while we are in, the closed study room or in a closed environment, of course, okay? So nonetheless, you have to fix your schedule according to the course as well, because, you have to give your, the extra effort as well, isn't it? Because of course, we are also taking time out from our schedule and everything. So yes, we have to accommodate, but we do see as a, the mentors and as an organizing body that if there is, a lot of, the trouble, so yes, we do reschedule as well. All right. So don't worry about that. So how to succeed in part 3? Look confident. Yeah. See, look at this lady. Look confident, appear as a safe doctor, be logical and be organized. Okay. Don't jump from the start to the end, and then, don't do a lot of jumbling, fumbling, and, the shuffling as well. All right. Doesn't matter. You can always come back. If you have missed your important aspect of your history, and in terms of, like, for example, most of the time as exam candidate, we do miss to ask about, the allergy. Okay. So you can cover it up by the end of, your management. If you think that you have to give any kind of medication to the patient, at the same time, you can cover this. Oh, I'm sorry, I forgot to ask that. Are you allergic to any medication or particular, the thing? Because I have to give you, the medication for your problem. So you can cover this thing up. So make sure 10 minutes are yours, okay? But not, the so much that, you have started with your history, then in the middle of that, you have started your management, and then in the end, you have again, they started taking the history. So it should be, very organized. So make sure that you're preparing in a way that, you are taking just like 4 to 5 minutes for your history, and you are coming, the back to your, because at the same time, if there is a kind of you have to break the diagnosis, so it will take almost 1 minute or 1 minute or few seconds. Then you have to come, then you have to involve the patient again and again, then you have to give, you have to check her understanding, then you have to give her some, the management. Okay, so remember, like we do in our day-to-day practice as well, what we do take history, we do offer, some kind of investigations. Before that, we do examination, then investigation, and then comes management. So how come you are forgetting this in your part 3 exam as well? So do you think that, any patient anywhere in the world is different than the patient which is being described in the books or curriculum? The answer is big no again. All right. So be logical, be organized, be sympathetic and empathetic. So don't forget that you have to validate patient's concern as well. You have to acknowledge patient concern as well. All right. Be patient. Be patient and as an active listener as well. If you're not listening to the patient, like Dr. Uzma said very, the rightly, that if you have your own agenda in your mind, and if you just want to fulfill that agenda, you will surely fail this exam. Listen to the patient. Maybe she has something to give you in terms of help. Maybe she has something to offer you as well, to do. So take cues, take in the patient's cues. Maybe she has, the something to ask. So please don't fix your mind into that agenda as well. So use simple and understandable language in polite tone. Change your character, like I said earlier. Okay, leave the one character of a doctor at the previous station. Don't take the baggage at all. And I would like Dr. Uzma to comment on this reasons to fail part 3, because it is a very hot topic, isn't it? Because nobody wants to fail. No student from anywhere, any part of the world wants to fail any exam, but we do fail, isn't it? So possibly what could be the reason, Dr. Uzma?
PSA, definitely. Of course, nobody wants to fail, and we all feel that, yeah, we were fit to pass, but the examiner, they are the ones who failed us. It doesn't work this way, okay? It is very immature to think like this, because there's always something which is lacking in us, in our preparation, in our performance that day, which couldn't, get us through this exam. Because I also failed in my first attempt. Once I went, because I passed in my part 2 with the, good marks and all. So I thought, part 3 will be nothing. I am very good with communication. But I was very, very wrong. I didn't understand what part 3 was about. Once only I sat in the exam and I went through all this 14 stations, then only I understood that it is different. It is not like that. So it's, you have to understand, as I said earlier, that what is being asked from you, focus on the station and just keep practicing. Keep talking to your patients in the way you are expected to do it in the exam. This is a very important thing. Okay, so if you don't start applying what you want to pass in the exam in your daily life, it will be very difficult to you to act only for those 14 stations. At the end of the day, your natural will come out of you. Okay, So, and these people, they are not stupid, no, they're examiners. They know that when you are acting and when you are being real. They understand everything. That's what I was saying, that your body language is very important. If you want to show some sympathy and empathy, your body language should go with it. So people might say that, okay, you know, that examiner was bad, that role player was rude, this was wrong, this was, it doesn't go like this. There's always something wrong with us. We have to focus on that. And mostly it is, we are not reading the station properly. That leads to our failure. Okay. So those 2 minutes of reading time, they are very important. Make your notes for it and then go with full confidence and a smile on your face. But yes, if it is IU every station or a Breaking Bad news station, please don't go with the smile. Little congratulations. Don't do that. Please, situational awareness is very, very important. Okay. Many people, they just forget because they are trained in such a way from certain courses and certain mentors that they just carry that thing, as doctor said, clones. You know, you will see clones of mentors there performing just the same way. It doesn't work like that. You are an individual, have a personality in yourself. You're not somebody else. I am Uzma, she is Zaib. We are different human being. We have a different personality. So be yourself. You have the knowledge. We are there to help you. Just train yourself and you can do the exam. Okay?
Exactly. And then, of course, you know, the why most of the time we fail, it doesn't, no, it doesn't mean that, you know, you were not practicing, you were not studying, but maybe the practice was not consistent. Okay. So you have to have a daily practice. All right. You have to have, you know, the very kind of persistent and daily practice as well. Plus, forget about this, that, you know, that only knowledge is going to be tested. So I will just, you know, the skim and scan my guidelines every time, and believing in the myth that only applied, you know, this communication will be tested. So, you know, we have been doing courses for quite long now, and I myself have seen so many students who do not want to perform structured discussion task at all. They are just interested in communication skills, you know, role play task. Trust me, you know, the role play task and the structured discussion task are equally important to pass this exam. Okay. None of the exam is going to be purely 14 stations on the simulated question task, and likewise for the structured discussion as well. So give equal attention, give equal importance to both type of task as well. Okay. So please, whenever you are practicing with your study buddies or with your mentors, so do try to practice both type of task as well. Okay. Because, you know, of course it will come with practice. So when you are going to practice a lot, so of course you are going to be judged on your communication by the mentors and all. So please don't use too many jargons. Okay. Like, you know, the, if you have to break a bad news, if you have to tell her in terms of, you know, the ultrasound findings or biochemistry findings or anything. So make sure that you are using a very, you know, the patient friendly language. And RCOG has had a very beautiful, you know, the phrases, you know, the kind of published openly on their website. So you guys can download it and you guys can, you know, the read it. Plus patient information leaflets are very good source to cover all these jargons. Plus another myth, like Dr. Hassan said earlier, that I am taking that course, so I am going to 100% pass this exam. I am going to take, you know, the 1, 2, 3, 4, 5, and so on courses, and I'm 100% going to pass this exam. I have, you know, a lot of material from here and there, from my friends, from my teachers, from, you know, the blah, blah, blah. I have a website to go through and I will pass this exam. Don't rely on this thing as well. Please take out this thing from your mind as well, that, you know, none of the course, none of the mentor, none of the material is going to give you a guarantee success. It is just you. All right. It is just you, yourself, your preparation, what you do in your exam. And this is what, you know, is sufficient. Me as a mentor, Dr. Uzma as a mentor, Dr. Hassan or XYZ, anyone can just guide you, can just, you know, they tell you how to prepare for this exam, how to go for this exam. Don't imitate me. Don't be like Dr. Uzma. Don't be like Dr. Hassan or XYZ. Okay. Like Dr. Uzma said, we are, you know, the individual. Okay, we do have our own, the personality. We do have our own, the way how we are going to behave in exam, our body language, our communication, our, the linguistic skills and everything. All right, so it will count. So please, please, please forget this thing that, the any of the course is going to give you a guarantee success. All right, and plus don't rely on ready-made template. Maybe, the phrase I use, I'm familiar with, is the good enough for me, but maybe it is not good for you. Maybe you will take a lot of time to memorize that phrase. All right, be yourself, be a unique individual in yourself as well. Okay, so don't rely on ready-made templates. There are thousands and thousands of things around, so many templates here and there. We also give templates to our students, but we always emphasize that, okay, until and unless you are going to practice the same, you are not going to get any knowledge or any benefit out of that, the ready-made template. And please, 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 this is going to be my sincere and a humble and a very honest advice to all of you going for this, the exam. Please don't memorize lines. Okay, it feels so bad while you are, the examining in the exam. Like for me, Dr. Hassan, okay, it really feels so bad that, every other candidate is coming and, they're rehearsing the same, the phrase and the lines and all. Plus, what if the role player is asking you a different question, and because you have memorized the set template, so what if you don't find any answer out of that template? Okay, so templates or material or courses or any mentor is a help. Take it as a help, not as a guarantee. All right, please believe in yourself. Believe in yourself. Okay, you have come this far. Only you, yourself. Nobody was with you. Okay, everybody was a helper along with your journey. All right, so please don't be like, a kind of, don't just lose your confidence, and don't be overconfident as well. Like Dr. Uzma said, that, and this was my mistake as well. This was my mistake as well. I said, okay, no, I'm teaching for quite long, and, communication is not a bad, the thing for me, so I will go, I will just ace and blah blah blah. But when I was in exam hall, so of course then I came to know that, okay, this was not like this. Okay, I had to prepare, I had to study. So of course I have failed at that time. And nobody wants to fail, nobody wants to take that, the result as well, that, okay, regrettably, unfortunately, you were not, the able to pass this exam, blah blah blah. All right, but once, you just scan, your result, the nicely. Once you just, go through your stations again, maybe you could find, the any of mistake. And for example, even if you think that you didn't do any mistake, then maybe, just think like this, that maybe that was not your day. Okay, because if it is meant to you, it will definitely come to you. All right, doesn't matter how many hurdles you will face, doesn't matter, the how many difficult questions you will face in exam. All right.
Yeah, this is all very, very important. Collecting lots and lots of material and stations and templates. And, there are people who just are coming and attending courses. Give me the template.
Template.
Template
Exactly.
will not help you, my dear. You have to study yourself. You have to make your own things. Then only you will pass.
And sadly, this has become a norm because,
Yeah,
I
it's
have been
very
teaching.
normal.
Exactly. And it feels so bad as a sincere teacher that, you just want to, collect templates for what? Excuse me, can you go to the exam and just, they narrate what I and how I speak? Of course, no. You may forget. Okay, be an individual, practice with yourself, practice with your study buddy, your mentors, take guidance, take help, but don't try to follow anyone as such, and don't imitate. Okay, trust me. All right, clear everyone? Any questions so far? Okay, so then another important question is being asked repeatedly from us, that how much time is enough to prepare for this exam? If you give your 100%, total 3 to 4 months study is enough to pass this exam. Okay, like for November exam now, if you start from July, so I think you can pretty much, prepare for November exam, and then you can go for this exam. All right. So path to the failure and success are same. Always remember, we can see two paths. Okay, paths are almost same. So what is going to make the difference? The difference is going to make is persistence your persistence, all right, your perseverance, isn't it? Hard work. See, these are the qualities which are going to be given by you for this exam. Sacrifice, compromise. Like somebody has asked that about the time. Of course, sometimes we have to compromise, sometimes we have to sacrifice as well. Compromise in terms of that, of course, this is the only day which I can, they give for my class. So, of course, I will request to all of you that can you please accommodate that because I only have this day to, give my class. So, of course, sometimes we have to sacrifice, sometimes we have to compromise as well. And time management, like May has, this said perfectly in the beginning, time management is very much important, and most important is focused guidance, all right. And as med exam team, we always try to guide and tutor candidates across the globe since long. We aspire to make positive change amongst examinees through our hard work, knowledge, teaching skills, and constant support for our candidates. Okay, like us. Okay, so let me introduce. So who is going to take your course? Who is going to be your, the mentor? Dr. Hassan Mahmood. Okay, Muhammad Hassan Mahmood. Then me, Dr.Zaib Qureshi, and our very own Dr. Uzma. All right. So all of us is going to be with you if you guys are interested in taking our course. So the Medexam expert team has extended a very, the relief program for the candidate who were unable to, the pass this time. All right. So you can go on and you can talk to these, the persons, and you can take help as well. And of course, we are going to start our, the long course from, this July, and hopefully we are going to finish by the end of, the October and the beginning of November as well. All right. So this way or that way, of course, we are going to be with you. So we do conduct a couple of, the free webinars, even in the middle of, the our preparatory courses, plus close to the exams as well. So do try to the attend those webinars as well. Plus we do conduct a free, the MRCOG Part 3 guide group as well on the Telegram. So they do try to participate there as well, because it doesn't matter that you are taking courses or no, we are always there to help. Okay, our doors are open, we are very open, the people, we do have open channels, all right, Telegram, Facebook, WhatsApp. So anywhere if you want to reach out, okay, you can reach out for guidance or anything. We will try to help as much as possible. Okay, so yeah, we are going
One
to
more
start our
thing,
long
please,
course.
if you, sorry, Zaib, one more thing,
Okay.
please, if you're planning to take our course or any course for itself, please participate, attend the session,
Participate.
okay?
Exactly.
It's very, very important. You are paying for this course, you need to participate, and we can only judge you, we can only, understand your weaknesses and strength once you perform with us.
Exactly.
Otherwise, how we will know you are just listening to the this one recording and not performing, not participating? This is not going to help you at all. So whatever
Exactly.
course you take, please participate with your full effort. Okay, that your efforts are at the end which will make you pass or fail. We can only
Exactly.
guide you. Okay.
Exactly. And plus, they do try to attempt both type of, the station. Okay. Like for me, I have been, the noticing quite, the long that everybody wants to participate in communication tasks. Okay. So please do try to give equal attention to structured discussion task as well. So this should be a take home message from now onwards to all of you, that you have to pay equal attention to both type of tasks. All right. So please, what is meant by the relief? Relief is for the candidates who have been unsuccessful in this May exam, or maybe the previous exam as well. Okay, so yeah, they are going to give you some kind of support in terms of the less fee, okay, or maybe the anything. So these are the numbers. Note them out. Okay, so you can reach out to these numbers as well. All right, so they will guide you. Okay. All right. So yeah, so the session is going to be roughly, the every 7 to 8 days, because we have to cover a module. All right. And then of course, the modules are divided amongst us, and me, Dr. Hassan, Dr. Uzma, we will take different modules. So we will support you in your study room as well. We will, the always try to, the give, the feedback even if you will perform, even only you will perform. If you will not perform, of course we will not be able to give any kind of feedback. Okay, so this is a two-way the process. You have to show your interest that you want to learn, so of course then we will give our best to our all students there is. All right, so yes, the how course works is that we will have the online session every 7 or 8 days, maybe roughly. The timing is going to be from 12 p.m. GMT or 2 p.m. or 3 p.m. according to the time zone of the mentor, of course, because we all are in online world. We are online, the from the different part of globes as well. All right. Then of course, the but still we do see from our candidates as well that what is the time zone for the majority. Apart from that, the session is going to be roughly 3 hours or maybe 3.5 hours. And if somebody missed the session, that is going to be recorded and that is going to be available on your portal till your exam. All right, so the things are very the easy, and all you need to do is you just need to the ask for help. If you will not ask for help, how we are going to supposed to help you out as well. All right, so this is how course works. And now roughly the now by far everybody knows about the all domains. So we will just quickly scan and we will just see that how all these domain works in all station: information gathering, communication with patient and relatives, communication with colleagues, applied clinical knowledge, and patient safety. So remember, each of the 14 tasks will assess between 3 or 4 of the domains, not all 5 domains. All right. So communication can be linked with applied clinical knowledge. If you don't know how to take history, how to dig out history from your applied clinical knowledge, so of course you cannot fulfill your communication. Plus communication with the colleague. For example, I am a ST2 candidate. I don't know how to do placenta accreta, the surgery. So if the examiner is asking me that, okay, now you have come across with the syntactic spectrum and how you are going to manage. So even if, I'm an independent consultant in my respective country, but for RCOG, I'm near a student. I'm a very junior student, ST2 level maybe. All right. So they are going to judge that where I want to stop. Is this candidate is going to stop somewhere or no? So I will say, no, no, no. At this point, I would like to involve my senior. I would like to involve my consultant. See, you have fulfilled your patient safety in the lines of applied clinical knowledge as well. So sometimes they are interlinked. Sometimes they are, the connected as well. So don't think that, everything is going to be separately judged. Maybe, the 2 or 3 domains will have, the high, the marks in that particular station, but not, the all domains are going to be tested in exam. Again, you don't need to pass all domains in one exam. Okay, maybe you can fail one domain, okay, but still you can score well and you can pass exam. All right. So in terms of information gathering, we have been talking earlier. So I will just conclude it that history taking should be in order. It should be crisp. It should be directed. It should be jargon free. It should be focused, and it should be easy and free of jargons, flowy, and it should finish in 4 to 5 minutes. And what can help you in taking history is patient information leaflets. There are a couple of, the information leaflets on RCOG websites. If you don't see any leaflet on RCOG websites, Google. Try using your mobile in constructive way. Okay, Google NHS. So there is going to be a huge number of the leaflets open from different NHS trust hospital. Okay, so all you need to do is you need to Google, you need to search. If you are in our course, of course, if you don't find anything, any source, you are going to write to us. So definitely we are going to help you out. All right. So patient information leaflets are good source for patient history. So how you are going to start your history? You're going to greet, but greeting should not be with the wide, big smile. If it is a very bad station, if you think that you have to, break the bad news or something. All right. So it should be very, the kind of subtle. Okay. The smile should be very, the half smile, or, the very, but it should not be a very mask face, computer, okay, or robotic face as well. All right. So keep your, the expressions neutral, introduce yourself, take consent that I am going to ask you a couple of questions which are going to help me in taking, this consultation forward. Then you are going to inquire, like we do ask in our clinics as well, history of presenting illness, Then we are going to inquire about past history, medical surgical history, family history, gynecological ops history, drug history, history of allergy, personal history, socio-economic history, and mental health questionnaire. All right. So it is very much important. So if you think that the question is being asked that just take targeted history because your main focus is to break the diagnosis, to break the bad news. All right. So in that scenario, don't, the finish your complete, the template of the history. Rather, lessen your history according to the needs of the station. All right. Then what are the sources to improve your the communication? Like for us, I would give my example that when I was a student like you, even till date, I used to read a lot of the information available on Google, NHS choices, patient information leaflet, RCOG leaflets, YouTube, very good channel. Okay, Vimeo, RCOG channel. Okay, so you need to just utilize your Google, your phone, your iPad, your computer very wisely. All right, everything is freely available, many things are there. Okay, if you don't find any source from the YouTube or Vimeo channel or anywhere, okay, what you can do is you can Google from other exams as well. All right, like for me, the PLAB videos helped me a lot. USMLE PACES video helped me a lot. Even the PACES, MRCP PACES, the UK helped me a lot as well. All right, so you can always Google from the YouTube how to break bad news in exam, how to tell this patient in this way. So if you will enter, the couple of the windows will open for you. Just observe, watch, how do they speak, how what are their body languages, how do they behave when they are giving any news to the patient, any management, any treatment option, how are they taking, how they are digging the history. All right, it doesn't mean that you have to become like them as well. It is just for the the sources to improvise yourself, okay, on yourself as well. All right, so you can use the any source you like to. Then applied clinical knowledge, of course, it is a comprehensive standing. Okay, it is a the comprehensive understanding of your part 2. All right, so then you have to finish your curriculum in relation to the clinical task in part 3 examination. You have to justify investigation, intervention, why you want to do the certain investigation. You have to justify that. Okay, I want to do your complete blood picture because I want to see the baseline hemoglobin, I would like to see the hematocrit, I would like to see the white cell count, because it can help me in finding out that you are having an infection. I would like to see the baseline platelets as well. All right, so this way or that way you have to at least justify what you want to do, why you want to do this intervention and investigation. Then you have to give your result. All right, you have to break the news, you have to give the result in very understandable flowy language. If it is a bad news, then of course you have to follow the breaking bad news steps. If it is a kind of a news which can be disturbing to her or him, so of course you have to follow the same pattern, but in a very polite tone. All right, then you have to give your the recommended option of the treatment as well. Of course, this is not going to be, if it is a case of cancer, you cannot treat cancer on your own. All right, you have to send the patient to the oncology center. So patient will ask you, perhaps, the doctor, what they are going to do for me. So at least you have to tell her that, okay, they are going to do a staging laparotomy. So how you have to do the staging laparotomy, that is your exam. They are not asking you to perform staging laparotomy whatsoever. All right, so they are just going to ask you that how you are going to describe what staging laparotomy is. So at least tell the patient, give her a kind of the initial understanding of the process as well. Nonetheless, she is going to be discussed in the MDT meeting as well, isn't it? So at least give her a clue that how she is going to be treated. Of course, this is not your domain, that you are going to treat this patient as well, isn't it? So applied clinical knowledge, we all are well versed of guidelines, NICE guidelines, RCOG guidelines. We have blog articles as well. So yeah, don't forget to revise your curriculum. The exam is not done yet. Okay, so a couple of stations are not going to leave you, till you become MRCOG, like maternal collapse, like the what you can say, the amenorrhea, the MRKH syndrome, like labor delivery scenarios, like breach. Okay, So all these things are going to be important from the TOG articles, from the NICE guidelines, from the RCOG guidelines as well. So revise your stuff. Communication. Communication is very much important. Okay, so you need to be very empathetic. You need to bring the kind of the very active listening as well. All right, if you're not active listener, if you're not responding to the patient cues, if you're not taking in any kind of information from the patient, so of course this is not going to be a two-way communication. Rather it is going to be just the self-centered approach, not patient-centered, the approach. Exam is all about patient-centered. Okay, how you deal with the patient, how you bring her to the point where she will be agreed for your the what you want to propose her as in terms of management. Okay, so if your patient is giving you tough time, if patient is not understanding at all, if patient is not giving you any kind of the positive the response, that she's not listening to you, okay, stop there and then ask her that do you think I need to repeat anything? Okay, would you like me to repeat anything? Please tell me if I was not clear at any point. Maybe she has some kind of agenda. Maybe she has any kind of other the cues to give you to the do the station forward. So you have to acknowledge, okay, validate concern, acknowledge her the pain. All right, don't just ignore anything. Doctor, I'm having pain. Oh, I'm so sorry that you are having pain. Would you like me to call any nurse, to give you any kind of painkiller injection? Oh, before that, let me ask you, are you allergic to any injection? Mhm. So, like this way, all right? And you have to take informed consent that, of course, you are going to judge the mental capacity at the same time as well, all right? So, for this structured discussion task, you have to maintain the teamwork. If you think that you have to examine the patient, which is very unlikely in exam, but yes, for some maybe you need to examine, maybe you need some with information. So if any examiner has extra piece of information, so if you will say that okay, I may have to examine you in the presence of chaperone, or my nurse will accompany you, then I have to do the examination, I have to do your tummy examination, then justify why you have to do the particular examination. Per speculum exam, why you have to do that? Per vaginal exam, don't say per vaginal, but bimanual exam, why you have to do bimanual exam? At the same time, you have to maintain dignity at all times and being sensitive to cultural and religious issues as well. Okay, so in face-to-face exam, this will be very obvious. Okay, so if you think that you are having a patient from the different cultural background, different religious background, they have the any kind of communication barrier. So of course you are going to ask. You are going to ask from the official translator, professional translator, interpreter. Okay, so you are going to ask that is it okay to continue the consultation, or the shall I ask my the colleague, the professional translator, to come over and they help me? Okay, so this is very much important. So it means by this you have scored at least 1 point, that you have acknowledged the problem in the beginning, and now you are going to carry out your consultation smoothly. All right, so communication is going to be like, both ways. Colleague is going to be the same. All right, where you have to stop, where you have to involve, where you have to involve your different specialities as well. All right, so do you think that you can manage one emergency alone? Of course no. We need colleagues, okay, from all our departments. We need consultants, we need hematologists, we need the blood bank, we need the laboratory as well, we need sonologists. Okay, so we need the couple of the people around. All right, and learn where to stop in the management as well. There is no doubt that you cannot the handle an emergency, but of course at the same time you need the force to help you. PPH we can't manage, any obstetrical emergency we can't manage alone. All right, then comes patient safety. Patient safety is very much important. We have been talking about it lately. So name, age, pregnant before or no, living status, last menstrual period, her BMI. Maybe, there are a couple of things which are not indicated with the BMI. Maybe we want to give her any the hormones. Maybe they are not indicated at certain BMI. Maybe we want to give any kind of medications which needs the double dose, or which needs the Another, the kind of different preparation. All right. Smear history, contraception. Smear history is important for gynecological cases, but even if you miss in OBS case, in pregnant case, so it's not going to cut any marks anyway. All right. So contraception, safe medication, alcohol, smoking, recreational drugs, history of allergy, proper referral. It is also very much important. Proper referral, you have to refer back. If you have a question that this patient has been referred from GP with this complaint, you have to refer back to GP. If this is a letter from midwife, you have to send back to the midwife as well. All right. So at the same time, you will tell it to the patient as well. Okay, so I will write back to your GP if you allow me. Okay, because he should be aware of whatever we have discussed in today's consultation. I am going to write back to your midwife because she has sent you here. So she will be aware of that, what we have discussed today. All right. So this is called closing the loop. Closing the loop is not only giving the patient information leaflet, but if the patient has been sent from the midwife, the GP, or any other specialty, so of course you have to send them back. Okay, you have to start your consultation. You have to check whether it is a GP or midwife referral. You have to perform in 10 minutes time. You have to write back to GP and midwife. Okay, then you have to give patient information leaflet and thank her. This could be plus and minus because sometimes by the time we are ending our station, 9 minutes and 45 seconds, maybe, we suddenly we remember something. So, we can always utilize our 15 seconds. So there is no hard and fast rule that you cannot come back to your station yourself. Remember, these 12 minutes are yours. These 10 minutes are exclusively yours. Utilize them now as you want to. All right. So how to start preparation? Any questions so far before I come to this slide? Any question? I hope domains are clear now. Is it clear, everyone? Okay, so I assume everybody has a clear knowledge about this. Okay, so let's move on to this part, that how you are going to start your the preparation. So Dr. Uzma, are you there?
Yes, Zaib, I'm here. Yeah.
Okay. Yes, please.
So as the slide says, that first of all, you have to organize yourself. Organize yourself means you have to take out time for your studying, for your preparation. So we all are, most of us are married, or even if not married, we are working, we have our family. So, we almost everyone is more or less in the same circumstances. And, all of us, with these circumstances, we all managed to pass the exam. So you can also do that. That's not a big deal. So organize yourself, take out time for your preparation. Okay. And please use only the RCOG provided resources for the preparation of your exam. That is very, very important, because RCOG is covering everything. Okay, whatever is not there in the RCOG, they will guide you to the European, like endometriosis or other things. So use the resources which are, backed by the RCOG only. So use them, go through your guidelines, practice as much as you can. And yeah, at the end of the day, you can do it.
Exactly. So organize yourself. Okay. Plan when it is feasible for you in all your circumstances. Okay, doesn't matter if you are the practicing, not practicing. Everybody has different lifestyle. Everybody has different the you can say the duties to perform in their day-to-day life, of course. Okay, so make a comprehensive schedule later on, that how you want to the prepare for this exam in view of your job and household responsibilities. Plus look for a good study buddy who is ready to take burden of your tough schedule, who doesn't undermine you and make you feel inferior. This is a very common, the kind of, the problem what we do see as a the teacher as well. Even in part 2, part 1, part 3, I have faced from, this thing. The people do come to me and they tell me that, ma'am, I have started my preparation with somebody, but she used to undermine. She used to take the extra time. She always used to take the simulated patient tasks. She doesn't let me speak. She doesn't the give. Okay, doesn't matter. This is not a the matter of life and death. leave that study buddy, okay, nicely, okay, because we all are, the grown-up doctors, okay, none of us is kid, okay. So make the everything so nicely, okay. Look for another study buddy, okay. It's like a right size of the pessary. We are trying to fit the right size of pessary, okay, into the right size of the patient. All right. So it's not a hard and fast rule, okay. So you can change whenever you wish to, and even if you feel that you are uncomfortable in studying with someone, maybe the time management is not good, maybe the time zone is different, maybe the she or he is not giving you enough time to speak. So yeah, change it, change the study buddy, doesn't matter. Okay, make template if you want to, and if you want to revise them by the end of your preparation. But I would not suggest to make the long templates. Rather, just jot down your points. All right. Okay, I have to ask this. I have to ask this in this particular station. I have to ask this. All right. So you have to do all available stations in books, and then you have to revise them according to feasibility. You can pick one or two online courses, because everything is the is like, I mean, kind of course, keeping in view of the inflation and all after COVID era. So be vigilant in this thing as well, because these days exams are going to be face to face, so maybe there are going to be a couple of on-site courses as well. So if you think that you can take the one on-site course, this is a very good idea, okay, because that is going to give you a real life face to face exam. Okay, because most of the time RCOG is conducting face to face course, and some of the other the mentors are conducting face to face. So if you can the attend any face to face the course, so that is going to be very good. Okay, master on your communication skills and revise your syllabus. So these are the books what you can do. Okay, the stations, some of the keys may be from outdated guidelines. Okay, like this book, this is a very old book, I think way back then, the 2013-14, but it has the very quality question. This is relatively new book, 2018. This is recommended book. This is new book. This is new book. Okay, I think this came in 2020. This came in 2019, if I'm not wrong. All right. So this way or that way, you have to do stations. You have to practice. Okay, at least if you have to, the study buddy. If you have a small group, all right. So make sure that you are, the one time one is becoming a student, the other is role player, then they judge each other, don't undermine each other. Okay, we are in practicing phase, we all are stressed, upset, depressed somewhat. Okay, so be easy on yourself, be easy on your role players as well. All right, so make sure that you are giving enough time to your study buddy as well, because everybody is going through hardships. So we should not increase the hurdles or troubles, rather than we have to the smooth the process. So how you are going to the plan, you have to have a vision, then you have to have a mission, you have to do strategy, you have to plan, and then of course success will all be yours. All right, so of course you are aiming for part 3. Okay, and this is your mission, that you are doing hard work and everything. You are the thinking for quite long that okay, I have to make a plan, I have to do apply this strategy, because my aim is to pass this part 3 and become a MRCOG, isn't it? So trust me, it is very much doable exam. All right, and the basic aim of part 3 is the candidate's ability to demonstrate core clinical skills in the context of skills, knowledge, attitude, and competencies. That has been defined in part 2. Part 3 is no different than part 2. Part 3 is only application of your knowledge. So study hard, study smart, and just ace it. All right. Any question, guys? So this comes to the end of our thorough conversation today. And I'm glad that everybody took the participation and all. But still, if something is not clear, we are here to help you, guide you through. Mm-hmm. Okay, very good. So I have a personal message. So it is fantastic. Very good. Brilliant. Okay. So I hope we have been able to give you some kind of insight about what you need to know about part 3. Okay. So if this is your repeat exam, so forget about your previous exam. Just learn through your mistakes. Okay. Improvise on yourself. improvise on your, the techniques. All right. So if you guys want to join us, so please, you are always welcome. We are going to start our course by the start of our, the next month, maybe July. Okay. So we are going to have our, the kind of a very good start from July onwards. All right. So apart from that, our doors are always open. If anybody needs any kind of help, you are more than welcome to reach out to us.
Yes,
Okay.
please, if anybody needs any guidance, anything, we are there. We are available on all the channels, WhatsApp and Telegram groups. So for
Exactly.
our med exam. So please reach out to us, and we will be very glad to help you. Because now, as you know, many people are doing courses, and there may be 1,000 mentors already available in Telegram groups who they want to conduct courses. But still, if you feel you are comfortable with us, we are available for you. And inshallah, we will, guide you towards success, inshallah.
Okay, thank you so much for your active participation, guys. Thank you so much, Med Exam team, for being with us, being our support. Okay, thank you so much, Dr. Uzma. And I thank me myself as well. Okay.
Thank you very much, everyone, for being part of our webinar. Thank you so much.
See you guys some other time. Okay. Bye-bye.
Thanks.
Bye.
Bye.
Bye. Thank you. Bye.